Health for all. In a country like India, good medical care is hard to come by, and where it is available, it is much too expensive. How then can we attain the UN objective of affordable health for all by 2025? The Archdiocese of Mumbai has taken up this challenge in a very novel way through its Health Promotion Trust, HPT. Listen to the director, Father Rocky Barnes, explain HPT's goals and methods.
I took over as the director of the Health Promotion Trust in 2009, and we had the prospective plan. In that prospective plan, we decided that we will have a new philosophy. Prevention is better than cure. And we started working towards more on preventive aspect of health rather than curative aspect of health. And with this, that we have been moving out to the marginalized groups, especially the tribal communities, the migrants, then slum communities, then we have women, children, those are vulnerable groups, senior citizens. To them we started moving out, and we have now about 50 centers where our training on preventive health care is going on successfully. And we have about 1,500 women and men are being trained every year who on this preventive health care, and they're coming forward after our training to give the testimonies that how this preventive healthcare training that we have given has been useful for them. And they are coming forward to say, to thank you for coming forward and giving this training on preventive healthcare. Now we feel better, and plus for us there is no need to go to the allopathic doctor, but what you have taught us through the training, that we are equipped with the natural remedies and home remedies where we can and our families and communities can remain healthy. So this is the message that we are taking it forward to more and more people and to the centers. So what we have decided, that also our experience is the conventional type of medicines, so-called the allopathic medicines, are giving a lot of side effects, and with the result also is becoming more and more expensive for the people to go for these type of medicines and all, and to consult the doctor. So but here that we can remain healthy by practicing some simple measures. For example, drinking sufficient water, give more and more importance to vegetarian food, fruits, salads. We also tell the people to go and exercise, move out and do exercise. And all these simple things what we teach them is helping them to remain healthy, so that there is no need for the people to go to the conventional types of medicines, which is very expensive, but by adopting a new lifestyle and try to remain healthy.
At the core of the health promotion campaign is the person-to-person approach, and most of these persons are women. It is through women that we reach the wider community. It is they who make the best animators and guides, promoting the values of good health. Here are some who have successfully trained with HPT, receiving their certificates at the hands of Bishop Agnello Gracious.
I like to explain to you, why does the Church support the Health Promotion Trust? Health is a subject that is of interest to us as human beings. And whatever is of interest to human beings is surely of interest to the Church. Jesus himself was very much interested in healing, and that has to be part of the mission also of the Church. We will not enter so much into technical. This the government is doing. We would like to give the kind of an inspiration to people to work for health of all, everyone, even the poorest can be and enjoy good health. And what I like very much in HPT is the emphasis on preventive health, so that we keep people healthy rather than cure them when they get sick. That is part of our goal, and that's why I want that the church supports Health Promotion Trust.
The preparation of herbal medicines involves selecting and crushing the appropriate herbs grown in a herbal garden, bottling them, and advising on their correct dosage.
हे नाचणी आणि गुळ हे खायचं नाही हा, त्याच्यावर माशी बिशी बसतात हा.
आरोग्य सेविका असं काय आम्हाला आवड आहे जास्तीत वनस्पतींची, आणि ते आम्ही ते यावं करावं आणि त्याचा आम्हाला उपचार व्हावा ही आवड आम्हाला आहे, म्हणून आम्ही ट्रेनिंग घेतो आणि ते औषधं बनवतो.
ही जे पालक जेव्हा शेतामध्ये वगैरे असते तेव्हा उगवते, तेव्हा त्यामध्ये थोडंसं खत पाणी म्हणजे रासायनिक हे असते, त्याच्याकरता ही धुवायची असते. तर ही धुताना आपण सॉल्ट वॉटरमध्ये म्हणजे मिठाच्या पाण्यामध्ये धुवायची असते, आणि मग मिठाच्या पाण्यात धुतल्यानंतर पुन्हा एकदा ती धुवायची, आणि तो पाणी आम्ही वेस्टेज न जाता तो पाणी दुसऱ्या कसल्या तरी म्हणजे राईससाठी किंवा ह्याच्यासाठी तो वापरतो, म्हणजे पाणी पण जास्त वेस्टेज होत नाही. आणि मग ती धुतल्यानंतर थोड्याशा गरम पाण्यामध्ये ती वाफून घ्यायची, म्हणजे त्याची सत्व काहीच नाहीशी होत नाही, ती पूर्ण आपल्याला भेटतात.
The personal testimony of the paramedics reinforces the success of this method.
I went to the pharmacy, it didn't work out, and I'm still finding I'm getting side effects from the tablets. So I thought of all this. She gave a talk on HPT. Sharon spoke about controlling about heart problems and all. Then I started consuming it. Then I went more into details and finding out how much more is there. And only when she has spoken about consuming it, there's much more on the leaves, which I have not yet tried. And the powder, which I am trying now, is already powder has been made. And after the thought of consuming seeds, the seeds also help me out a lot. Now I am not taking any doctor's medicine at all. I am only on this, eating the fruit and consuming the seed. Okay. I am both healthy, and my cholesterol, which was there 166, it has come to 82. Pomegranate is the best fruit for health, for health. Consume it. Any seasonal fruit you can enjoy it, although it's slightly costly. But I'm making use also of the skin which is there, which is poured to us, and I made powder form, and I'll be using the toothpaste or some pain. What is there? I'll do the try on it.
Besides, mothers can make these herbal preparations at home and encourage their children to take them.
हम लोग को ये सब सीख मिला कि घर में हम कैसे बना सकते हैं. बहुत जन देखो थोड़ा सा भी सर्दी हो, खांसी हो, डायरेक्ट डॉक्टर के पास जाए, लेकिन वो छोटी छोटी उपचार हम अपने घर में भी कर सकते हैं. अभी इतना 1 चम्मच लेना है और फिर ये इसमें डालना है. और अगर बच्चे पूरा नहीं पी पाते तो आधा गिलास पानी में डाल के बाद में, ताकि वो नीचे बैठ जाता है. आधे फिर वो मिलाने के बाद इस तरह हो जाता है.
My mother have learned from the classes where she goes, and she gives us every day in the morning. I doesn't like too much, but it's right for our health.
Much more needs to be done, however. Street plays, songs, and fancy dress skits also help carry the message across with imagination and expertise. Herbal medicines are affordable and effective. They are within the reach of all, not only in times of illness, but to keep you always in good health. Change your attitude. Use what nature gives you through fruits, vegetables, and water to keep you strong and healthy.
मिक्स करून आणि 21 दिवसानंतर त्याचा रस काढला आणि तो आता वाढीमध्ये ते काचेच्या
Bishop John Rodrigues congratulates the trainees and presents the philosophy behind the HPT approach.
Holistic healthcare looks at the person as a whole, and therefore we are looking at the well-being of the entire human being, his spiritual, emotional, social, physical, entire being and growth. And therefore through this holistic healthcare, through the various programs of Health Promotion Trust, what is being promoted is the well-being of every person and his or her relationships with others and the entire interaction of the community with that person.
And finally, Father Rocky once again.
So we would like to take it forward to many centers, as the vision of the Health Promotion Trust is that health for all by the year 2020. Now we are in 2016. So within 4 years, we would like to reach out to another 50 centers so that this message of preventive health care goes further and more people, especially the poor people, can get benefit from this preventive health care.